Welcome to Pediatric and Adolescent Hip Masterclass. This has been organized by MedVidya in association with SRCC Children's Hospital. My name is Dr. Taral Nagda. I'm Head of Department of Pediatric Orthopedics at SRCC Children's Hospital. I'm going to talk to you about fundamentals of hip osteotomy. The word fundamental is made up of two parts, funda and mentals. Funda means basics and mentals means thinking about. So we are going to think about basics of hip osteotomies in children. This talks comes from consultants at SRCC Children's Hospital in Bombay, India. The two reasons for doing a hip osteotomy are one, to correct the biomechanics, and two, to alter the biomechanics. And I'll give you some examples of each one of them. This is a child with coxa vara, and in him, you want to correct varus to normal neck shaft angle. So what you are doing is correcting biomechanics by doing a subtrochanteric femoral osteotomy. This is a case with hip dysplasia, and here the femoral neck is in valgus, the acetabulum is dysplastic. So what you do is varus and derotation femoral osteotomy and triple acetabular osteotomy, and this is an again example of a hip osteotomy to correct the biomechanics. This is a child with Perthes disease, and you do varus derotation osteotomy, and here you are not correcting biomechanics but rather altering biomechanics to help the disease to heal better. This is a child with fracture neck femur which is ununited, and you do a valgus osteotomy again to alter the biomechanics to allow the fracture to heal early. So these are few examples why a hip osteotomies are done, but basically either you are correcting the biomechanics or altering the biomechanics. And it's supposed to be a difficult and complex subject, and sometimes confusing because people make it difficult. Also expensive because people feel that the technology in implants are expensive. And what I'm going to do in this talk is going to make the principles of doing hip osteotomy very easy for all of you. So I've divided the planning of hip osteotomies in children in 4 steps. And these steps are called HOTT, H-O-T-T. H stands for hip. So the first step, we put hip in ideal position. Next step, we do an osteotomy so that the hip remains in ideal position, but the limb comes in neutral position. Now, when you do that, you bring about translatory changes. So you have to correct the translation. So in the third step, you correct the translation. And in the fourth step, you readjust the trochanter so that you can restore the tension in the abductor muscles. So these are 4 steps of doing any osteotomy of the hip joint.